This is the C-Section Experience podcast, where we support you in preparing for and processing your C-section journey through education, validation, and storytelling. We're here to reduce anxiety, amplify your voice, and help you feel truly seen. I'm Dr. Jen, an obstetric anesthesiologist.
And I'm Bethany, a nurse and a birth educator. As friends and fellow C-section mamas, we're on a mission to empower you. Through personal stories and expert guests, we'll laugh, we'll cry, feel all the feels, so you can approach your birth with confidence. Are you ready?
Hey, Jen.
Hi, Bethany. Today we are going to discuss elective C-sections, but I'm going to tell you there's really another term for this. But essentially, we are answering the question, can you choose to have a C-section? Mm-hmm. And we're going to discuss why people might choose to have a C-section, what OBs are obliged or not obliged to do when it comes to a request like this. You talk about elective C-sections from time to time, but people still have that question. Even within the doctor community, I hear people discuss, I want to request a C-section. My OB says no. Is that okay? Is it not okay? And it's a bit of an
No, I think it's a super important question.
Yeah, it's a bit of a discussion. So I wanted to bring up the terminology first. When we think of elective C-section, what we're talking about really is cesarean delivery on maternal request is the technical term for it, because elective C-section is sometimes used when there really is a medical indication. It may be kind of relative, but there's something there.
Can I just say, I'm not certain. I mean, when you use that word, I'm like, did I have an elective C-section? Like, I actually have thought about that a little bit.
Yeah, that's a good question. I would say, well, if we're using the term elective to mean not cesarean delivery on maternal request, I think, yes, elective, not cesarean delivery on maternal request. But that's usually, we think of, I wanted one, I chose it.
Right.
There was no reason.
Like the mom
You just wanted
deciding. Right, okay.
There was no medical
Right. So my doctor.
or fetal
right.
indication for doing it. And it's so funny that you don't know if you
I know.
had a reason or
I'm
not.
aware of this. It feels like, are you serious? Yeah, but as we've talked about it, and then I think about the reasons why I had my C-sections, I wanted to have a C-section because it made me feel more confident in the safety of the delivery of my baby.
Yes.
And that was huge, but I don't think I ever really thought about that when my MFM was having this discussion with me. I was like, you just tell me.
You might get some clarity after I go through a couple of these things. But I am curious, since you brought it up, do you remember how the MFM broached it with you? When did it first come into your mind, I'm going to be having a C-section? When you got pregnant? Before you got pregnant with Souther?
I don't think I could see the end of the tunnel until I actually was pregnant, because we had some fertility assistance with getting pregnant with Souther. So yeah, I don't think it was until I was in my second trimester that I even really
Considered the delivery?
Yeah, I kind of accepted the pregnancy. I was so scared that I just was
you didn't think about the finish line.
I didn't think of the finish line. No.
That makes sense.
Not until my second trimester, for sure.
So then when you start thinking about the finish line,
I think it was just presented to me that we're going to deliver the baby at 38 weeks and
via C-section.
Via C-section. I was like, okay, that sounds like a great plan. But I think it goes back to one of our discussions we've had. Oh my gosh, feels like so long ago. I think what probably my doctor also picked up was on the detailed anatomy scan at 28 weeks when I lost it and was so hysterical and couldn't control. I think that probably at that point he was also thinking this is going to be the mode of delivery that's going to be best for her, with the medical reasons as well, with being on blood thinners. But I think that he had to pull in my emotional state with his decision as well.
And that could be, I don't know, maybe he has a knowledge of people who have experienced these kinds of losses being better candidates for C-section birth.
Mm-hmm. Yeah.
And if you seem to be very receptive when it was brought up, maybe they just didn't go further.
Yeah.
True cesarean delivery on maternal request is only 2.5% of all C-section births. the way ACOG phrases it is that if there are no medical or fetal indications that this would be physically safer for mom and baby, that the recommendation should be for a vaginal delivery. And they say that this shouldn't be a discussion, I guess, with every patient. So any patient who comes in, you shouldn't say, oh, there's an option for you to request a C-section if you want. If someone brings it up on their own, then there's an acknowledgement that accepting this request is part of patient autonomy, and their own ability to make choices about how they deliver their baby should be respected, essentially.
100%. Yeah.
However, I thought it was interesting because I get upset if an OB doesn't honor this request because I know that that can happen. But I guess professional standards don't oblige the OB to do that. What you're supposed to do if you're the OB and a patient requests a C-section and for some reason you don't want to do a C-section for simply the reasons of maternal request, then you immediately refer them to somebody who will basically follow through with their wishes. That's kind of how the professional organizations discuss it. It's such a small percentage of C-sections that, first of all, it's not well studied. There really aren't any studies on outcomes for women who make this choice because, and we'll go through why people might choose it, but they're just, it's all lumped in. When they discuss outcomes related to C-sections, they lump them in with these other reasons for C-section, which isn't really fair, right? Because things can get muddled.
Yes.
And so there's not good data. And then when we talk about reducing C-section rates, they don't really go into that very heavily. And I think rightly so, because it's not driving anything, at least in the United States. In other countries, there are different cultural values where a lot more patients request C-sections because that is the culture to do so. And so that maybe if you attack that, why are so many people requesting C-sections, I think that could be a way to reduce C-sections in these other countries. But in the United States, it's just 2.5%. It's like, it's not some big thing. But as we know, there are people that really feel that this is the best decision for them. The way that OBs are supposed to counsel people are just asking why they want to avoid a vaginal delivery. So that's really
that's a
what
fair
it is.
and that's a fair question. Like, just as if you're asking as the patient for this to be your mode of delivery, I think it's fair for the doctor, and not in a challenging way, but just asking why. Because it's probably opening up a discussion or a bigger conversation as well.
Yeah, so you have to have this risk-benefit discussion, and there are risks and benefits with both modes of delivery. And then if they decide that this is a well-informed patient, then ethically, professionally, medically, that makes sense to proceed with the patient's wishes.
Right.
Interestingly, there is a smaller subset, I think, of patients who come in labor and request C-sections, and that is
And there's their data
more
on that.
complicated.
Right. And is there like a study on?
No, there's no studies. It's just, it's more ethically complicated when you can't have a discussion about the risks and benefits ahead of time.
Okay.
When mom's in a lot of pain and they don't want to be in pain, one of the reasons that people are fearful, I guess, of vaginal deliveries or want to avoid a vaginal delivery is a fear of labor pain. And so that's a good opportunity to have a discussion, have an anesthesia consult.
Oh, yes.
It's a very, very good reason to discuss pain management options for labor and then to discuss the pain that is also present after you have a surgery, of course, and weighing those two things. When I look this up, in these academic articles, a lot of times there's trauma, violence, or history of poor obstetric outcomes or history of poor experiences, bad experiences with a previous labor. This word tocophobia, have you heard of that? So that's Kaylee Summers brought it up when we had the conversation with her that she has patients with tocophobia, which is severe anxiety or fear of childbirth.
Okay.
And it's treated with therapy. So you can, if you're diagnosed with this, you could, or if the OB recognizes this as maybe the reason that you are requesting a C-section, that, you can try therapy and try to see if that can be mitigated or treated. And potentially then you wouldn't necessarily want the C-section anymore, I guess. But what Kaylee Summers was saying is like her patients with tocophobia, like this is really, really so helpful for them to be able to deliver via C-section, and how serious of a condition it is. I think it's so easy to say, oh,
it'll be fine.
This woman just like being afraid of labor and, suck it up. But obviously it's a real, true issue
condition
that people have. And it's probably more common than we think. Up to 10% of people have this. And, obviously to probably different varying extremes. But
actually, I took my kids to the dentist the other day, and she's about to deliver, and so she has this like cute little coin thing of like picking boy or girl, and whoever wins like gets a gift card, blah blah blah. And my kids were like, oh my gosh, this is so exciting. And then somehow we got chit-chatting, of course. I was like, how are you feeling? She's like, I'm actually so afraid of labor. And it was like, I mean, I don't like, she's my kid's dentist. Like we were like not having like very personal conversations, but the fact that
so first time mom,
that she just like said it. It was like, that was her. She's like, I know we're doing this cute thing with the boy girl thing. She's like, but I'm really scared. And of course I took the opportunity to be like, well, then you should listen to my podcast with my girlfriend who da 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 da. But I think that for a lot of women, that is a very, yes.
Yeah.
Of course you're going to be nervous about something that could go so many different ways. So again, back to it's a little complicated if they're requesting in a state of mind that's not very clear, if you're in labor or something like that. However, there are plenty of people, and I think it's this 2.5 to 3.5%, that have really thought about this. They have real reasons, Right.
These like real fears, real anxieties, real traumas in their life that have made them really feel like this is what is best for them.
Right. Which is why it's so important that this is something that people know that they can request if it is a big fear factor for you.
Yeah. It always is so interesting to me that all these surveys of doctors, specifically doctors who actually have a lot of knowledge of childbirth, are ones that tend to much more frequently request a C-section than non-physicians. Midwives, on the other hand, don't, though. They like never do. But OBs, urogynecologists, colorectal surgeons, and family members of those specialists are much more likely to request a C-section.
That's interesting.
It's so interesting.
Yeah.
So the benefits, of course, are some of this has to do with knowing the date of the delivery, your medication point, timing medications. But really, for some people, knowing the exact date of delivery, that can help with work and with childcare, with help at home, all of that. Of course, the alternative would be an induction, but that is a benefit to a C-section. They're usually scheduled at 39 weeks. Same as, this could also be, you can do an induction, but being scheduled at 39 weeks, people who have fears about continuing the pregnancy to post dates and everything that can happen with that, and increased risk of stillbirth after a certain period of time, knowing that the delivery can be at the point where the babies are full term and the babies can be delivered, that makes a lot of sense, right? Yeah. This is also such a good point. Electing a C-section. It avoids complications associated with emergency C-sections because planning a vaginal delivery and having a vaginal delivery are not the same thing.
Of course. Yeah.
So if you're electing a C-section, then technically you're still having a C-section, but you're not having an emergency C-section for sure.
Right.
And emergency C-sections, as we know, are associated with a lot of traumatic experiences, but also increased risk of complications surgically as well after you're in labor and all of that.
Okay, I have a question. I don't know why this just popped into my head, but what if your partner was like feeling really set on being like, I think it would be best for you to have a C-section?
I would say then you have the baby.
I don't know. I'm just saying maybe the partners have a fear. Maybe their mother had a traumatic birth and they're feeling fearful for their...
Well, that would be a good reason to be like, why do you want this?
I'm just saying this could be a conversation.
Well, one of the things that I think is very valid is if you have like a close friend or family member who had, let's say, a complication related to labor or vaginal delivery, how could you not worry about that?
Of course.
And so that is valid. Of course, it's something that let's talk through this and really talk about your risk for this happening. And again, risks, benefits, right? And the risks and benefits that come with having a C-section. But that certainly is one of the reasons. It might not be personal trauma. It might be your friend or family member that had some kind of traumatic experience. And you're just trying to avoid that path, whatever that was, and be different.
Yeah.
There is this perception, which makes a lot of sense for the people like yourself and many moms who just want that baby to be safely delivered and soon. There is a reduction of a lot of neonatal issues, except for respiratory, as we know, but in all the other things that can happen during labor, essentially, like many things.
Right.
And it does technically, if we're doing a pre-labor C-section, take away the risk of any of those things happening because you're not going into labor. But again, this isn't ultimately the recommendation because there are so many alternative benefits to a vaginal delivery, but let's not ignore the facts of the benefits to the elective C-section just because overall the weight of the risks side with the vaginal delivery. If you don't have a reason, basically it's okay however you feel, right? But if you're just neutral, then yes, there's more risk with the C-section, but there are some benefits. So that's what we're talking about here.
Yeah.
Also transmission of infections. So specifically herpes viruses, HIV. If the HIV viral load is high enough, then a C-section would be indicated. And then the main thing with risks that moms need to really think about is how many children that they want to have in the future when counseling on C-sections, because that's really where the main risks lie. And we've talked about a common question, I guess, is how many C-sections can I have?
How many C-sections can I have, Dr. Jen?
I mean, there's not a real answer to that. With every subsequent C-section, the risks increase. But I've said before 5, when I was reading about it, this is what they said too. They said if you're pregnant and you're requesting a C-section and you want more than 3 additional children, which would mean, assuming that you request, that's 4. So they're saying the 5th C-section, maybe it's better to keep it under 5.
Yeah.
No one says it exactly like that because you can't. You can't be like, well, this is how many kids you can have and how many C-sections you can have. There's no such thing. We don't control how many times someone gets pregnant and how many babies they want to have. But that is really where the risks get exponentially high after that 5th C-section.
Anyone who has more than 5 children, I give them so much credit. I'm struggling taking care of 3.
Yeah. Well, I mean, look.
Motherhood's really hard,
Some
Jen.
people have kids over like longer period of time.
I know.
They start when they're younger.
Yeah.
There's lots of reasons we choose to have the number of babies we want to have. But if you have a clear goal in mind, that would be something that they would ask. How many kids do you want to have? That would be part of the counseling. And just for someone who is listening to this because they want to request a C-section, I think it might be helpful to know what are they going to ask of you? And that will be one of the questions is how many children do you want to have? Of course, we can't predict any of this, but that's just the question.
Yeah.
And if you said, I want 6 more kids, they might say, well, let's really talk about this a little bit deeper. We might want to think about if that's really the best path to go down, essentially.
Totally.
But, we believe that women who have made this choice are well-informed and have history of something that is really hard. And oftentimes having the choice to be able to birth in a way that makes that thing feel less hard. That's a part of respecting a patient's involvement in their care, involvement in the choices that they make.
And I think it's also kind of like looking at somebody in a whole, right? Like if there's just that mental component versus maybe just the physical fear of pain versus mentally thinking like if I delivered vaginally, I would feel that not having control would set me up for trauma like afterwards, right? And I feel like that's in my case, taking back, there is so much that is out of your control. So for me, taking back some control was so important. And I don't know if I maybe realized the magnitude of that at the time, but I can tell you now that when I look back on each one of my deliveries, that was a very important piece of the puzzle for me.
So many people in the birth space talk about C-sections as a lack of control. But on the other hand, that is a big, huge, massive factor for those people who do want to request a C-section is it's giving them control.
Yes.
It's just all about how you think about it.
Yeah. And shifting that like positivity. Like to me, I looked at it as a positive thing that I was getting to have that control.
Yeah. And you're not the only one because it's on the list of factors of reasons women choose it is the need for control. In so many ways, it can give that control back, that unpredictability.
Exactly.
I think is maybe the word.
Right. Yes.
How long is this going to take, this labor? What are going to be the ups and downs over the course of many hours and many days, potentially, versus at least with a C-section, these are the steps. And if you can wrap your head around that, what those steps are, how each piece is going to go.
I also think in the birth space too, it's very interesting. I've seen this with clients too, like their personality trait outside of pregnancy is not who they almost like become when they're pregnant and when they're thinking about their mode of delivery. I'm like, I'm not like a very controlling person at all. But like when I became pregnant, when I went through that process, when I was thinking about the delivery, I did become that person all of a sudden. It just wasn't.
I don't think you were becoming controlling. I think
I wanted to take back.
I needed
that control, but I didn't know that about myself, right? Until I entered into becoming pregnant and delivering.
Yeah, I mean, it makes a lot of sense within a pregnancy after a loss to want to take away some variables.
Yeah. I think it actually helped a lot with my healing too. And like anybody who is seeking out an elective one, I think there's a big component to a healing aspect. For me, I felt like it helped with my past trauma and kind of completing that healing loop a little bit as well.
In what ways? If
like,
someone says how
maybe like taking some of the blame off of myself. I think when you have a loss, it's hard not to think about, did I do something, and have that like blaming game with yourself. I went through that a lot.
Having the doctor perform the surgery was a way of you kind of saying, here's the expert.
Right, right. Like if something, God forbid, had gone awry, like I would have, that trauma that I already felt, and then going into another delivery and something feeling like I didn't trust my body, I didn't do something right, and then I ended up in an emergency situation, I would have blamed myself like, but you could have chosen something differently. Like, I don't know. Do you see where I'm getting?
Yeah.
So I do.
Like
I
chaos. It's like a little like less chaotic.
Yes, that's the word that I'm looking for.
And because who knows if you would have planned a vaginal delivery and then you could have had an emergency C-section anyway, and that would have been so much scarier for you.
For sure.
And you would have questioned everything.
Everything, yeah. I wasn't willing to open up the old wounds. I needed the wound of the past to stay.
Yes.
As it had been
and
slowly
you need to have
stitched up.
a totally different experience.
Yeah. I totally needed to separate the two. And I think that maybe that's why some women choose it as well, right? Is that when you need to separate the births. Like I also needed, like I was so grateful that there was a boy and not a girl because I needed to like separate the gender. I needed to pull as much separation away from that previous traumatic experience. And that in itself is a reason why if you were wanting an elective C-section, that would be a good enough reason.
Yeah.
Right?
100%. Whatever you need to do to get yourself through whatever it is that brought you to that point is fine.
And I think going back when you said like with the provider, that's why having a provider that you really feel, I mean, I know it's not always an option, but if you can find a provider that you feel really understands and hears you, that is so important.
And maybe in some ways your MFM did just really understand you and just really did know what was best for you. Because it was obviously on the nose.
Yeah.
Correct.
For sure.
Yeah.
Oh, yeah. I mean, like I said before, he's like this like older gentleman. He reminded me of my grandfather. I just like felt safe. I just felt safe. And I think that going into the birth space is so important.
And I'm glad that no one did question you.
Yeah.
Because that would have been
I didn't even know what I would have
hard.
done. I would have felt, I mean, I can see, I think that's why it was important, like to say what are the discussions that are going to be have if you say I would like to have an elective, because I think going into it being like, these questions are going to be asked for a reason and not looking at it as like they're challenging me. They're stopping me from making this decision.
No, there is a professional responsibility to say, this is what is considered to be recommended. They're going to have to discuss the risks and the benefits. And the reason why this is okay compared to like going against, I don't know, something else where this is good, this is bad, is that there is no guarantee that you'll even not have a C-section if you plan for a vaginal birth. Because imagine if you talk someone out of an elective C-section and then they end up with a C-section but an emergent one. How did you benefit the patient?
Right.
You didn't.
Right.
And you can't guarantee that.
Right.
You absolutely can't guarantee that. So that's where it becomes pretty clear that if someone comes in and has this request, they should be taken seriously and I guess
respected for it.
Ethically, OBs can supposedly choose not to do it, but I would say I'd make that argument. Well, what if this patient ends up with one anyways? What good did you do for them if you really think that's the better road?
Right. And maybe it's just like a gut feeling too. Like I feel like even in my case, it's like I think just my gut, I just knew. I just knew
this was
going to be the mode of delivery.
The best for you.
Yeah. Again, starting as a doula and then ending up as a C-section mom was like not what I thought would be my road, but things happen and things change. And I think that's also where respecting both sides is so important because there are just life changes that really impact you in a way that there's no crystal ball.
No. And we just have to do always what feels best and safest for us and feel prepared going into it and be that well-informed patient.
Yes, be that well-informed.
Who has heard the risks and benefits.
Yeah.
And the more well-informed you are, the more consentable you are in the sense, you can make true decisions.
Can I tell you what a therapist once said to me? Enter things into as a conversation, not a confrontation. And I think when you're having that conversation with your OB, enter it into in a conversational manner. Like, don't create the friction before the conversation has started.
Right. We have to listen. Maybe there'll be something that will change one person's mind or the other, or maybe there won't. But you have to go through the process.
Yes.
In order to get to that point of being that well-informed patient who now everyone can agree this patient is well-informed, this is the choice they are making, and we are going to
support them.
Support that choice.
Totally.
All right, that's all I have.
Okay. Thank you for clarifying that.
Anything to say? No, nothing to wrap it up.
No little wrap up.
We can talk about my tick bite. No,
we could do a breathing exercise.
All right. Well, thanks everyone for joining us. Check out our website, csxpodcast.com, and download your free C-section guide.
Get our socks, 50% off. They're super cozy. They're hospital safe with the grip bottoms. And you got your mantra on there. I got this.
I got this. You got this.
Yeah.
So we'll see everybody next week.
Bye.
We had so much fun recording this episode, and we hope you enjoyed it. We are also now on YouTube, so please head over there and subscribe to our channel to watch our full episodes.
We love having all of you as a part of our community. Please take a moment to rate, review, and follow the C-Section Experience wherever you listen. It really helps us grow and reach more amazing listeners just like you. Bye.